name is Clemson and I'm the healthcare manager at HMP Stafford. My background is working in learning disabilities and I've worked in a range of roles, both in the community and in secure settings, and I've also worked in management roles as well. When I first entered the prison on my first day of working there, I don't think I really knew what to expect. I expected it to be noisy, to be rowdy. I expected to perhaps get some verbal abuse from prisoners, and apart from that I wasn't quite sure what to expect from my first day. Working in prisons is kind of stepping into another world in one sense. There's a lot of, prison officers and prisoners use a totally different language that I certainly wasn't used to. So there's a lot of getting used to the language that people use. The environment can be quite noisy at times. You get lots of interruptions into your work, but also you get a lot of respect back from prisoners, and you also feel a real sense of working as a team, not only as health professionals but also working with prison officers, other members of the prison service team such as safeguarding, education, all of those people. And it's important that we all work together to meet the needs of the prisoners within our care. I personally feel far safer working in a prison than I did in a secure hospital. We have one nurse who runs an anxiety management group, which she's been running for about the last 12 to 18 months. And a lot of the prisoners who've been on that course have been quite problematic prisoners in terms of behaviour-wise. But I've highlighted that a lot of these issues are around managing their anxieties, and she's had some real success stories from prisoners who've been on those anxiety management groups, who've then come out and said, I now feel ready to go back into the community. For me, a bad day would be what I would call a frustrating day, which would be that you've got your plans in place. For example, it might be that we're going to do a clinic that we've planned for 2 weeks to do on a certain day, and something happens within the prison, which is perhaps a breach of security, which obviously then the prison has to go in what's called lockdown, which means that we can't access any prisoners. Skills and attributes that would help you working in a prison, I think, are being calm under pressure, being methodical in your thinking, being organised. Organisation is huge in kind of making sure that everything runs on time and you see who you should be seeing. Have excellent communication skills, because not only are we communicating with our patients, but also prison officers. You could be communicating with a prisoner of a young age, somebody of an old age, different ethnic backgrounds. I always describe working in a prison as working with your own community. Everything that you or I would expect in the community is what our prisoners expect as well. So it might be that you have somebody who presents to you with a sore throat, you might have somebody presenting to you with chest pains, you might have officers coming to you saying that this person's behaving a little bit odd, and have concerns about their mental health. You might be talking to somebody who's got thoughts of self-harm. You just never know what's going to happen, and I think for a nurse to work in prisons, they can gain so many skills that can give them so many foots onto ladders for the future, and can be trained in so many skills as well. My favourite memory, I would say, is the thank yous that you get from prisoners. Somebody takes the time to write you a letter to say thank you, this is the first time that somebody's listened to my issues and helped with my issues and now feels though I can move forward. I think that's a real boost for anybody.